Hi folks, this is Glenn Maurer here on The Next Step TVSB. We're going to do a show today, as you saw on the front there, who's stopping affordable health care? Why can't the United States do what the rest of the civilized, industrialized world has done and provide its people with affordable, reasonably priced, quality health care? To discuss that, continuing drama in America, we have with us Peter Kahn, who is you have a title, Peter? Share?
Outreach Coordinator for the chapter.
Outreach Coordinator of the Santa Barbara chapter of Healthcare for All, a group that has multiple chapters in the state and I think affiliates in other states, working in the grassroots level trying to bring better health care options to the people.
Correct. There are several states, I think more than 20, that have single-payer movements, and we are one. We're not directly affiliated with them. Many of them have Healthcare for All as part of their title, but we are separately.
But it's a grassroots effort.
Yes, it's grassroots efforts, and then in coalitions with professional organizations in nationwide. There's Physicians for a National Health Program, and in California there's a California chapter of that we affiliate with, the California Nurses Association. There are many other organizations that are in coalitions that are trying to get single payer.
Healthcare for All, the logo is on the screen, and hopefully that'll inspire people to contact you. I think your email address or phone number is going to be up there occasionally, but if people want to talk about this, how would they get a hold of you?
My phone number is 682-5183.
That's 805 in Santa Barbara.
805 in Santa Barbara, right?
Okay, so one of the things that your group is doing is to try to bring facts, information to the public about some of the truths about what's going on, not just in California, but in the world in general. And one of the lies, one of the greatest lies that the opponents of single payer or affordable care come up with time and time again is that people in other countries are unhappy with their socialized medicine, quote unquote, socialized medicine. Canada, Great Britain, France, Europe, and we know that's not true.
Right. As a matter of fact, the U.S. probably ranks last in satisfaction. There was a survey of 11 countries. We ranked 11th.
Yeah, and that's also at 2 and 3 times the cost.
Right, 2 and 3 times the cost
of what those countries do.
Plus, we're not covering everybody.
Right. So one of the things that you're doing as part of your community outreach is you're going to be showing a documentary called The Healthcare Movie soon, on June 20th. So those of you watching this show might have an opportunity to catch that. And we have a clip from that show. And if we can get that on the air now, we can get a little taste of what this is about.
What do you know about Canadian healthcare?
Very little.
We have a shared history of the development of our healthcare services. In both countries up until about 1950, we had pretty much the same system.
How does your healthcare system work for you?
Lousy.
And how do you feel about your healthcare system?
I think it's wonderful.
I can't say enough good things about it.
I just thank God every day that I am a Canadian citizen.
I'm happy to be here.
I'm very lucky.
We are blessed.
Every time that I've absolutely needed health care.
Because of our
We've had excellent
Canadian
experiences in healthcare here.
Canada. Very pleased.
I would choose the Canadian system.
I really like the healthcare system.
All in all, it's pretty good.
I have nothing but praise. How has the Canadian healthcare system treated you?
Well, we're still alive. I think it's the result that counts.
This is not the president's house. This is not the Democrats' house. This is the people's house, and the American people don't want a government takeover of health care.
If the system is so bad and we're all so strongly supportive of it, you must think we're really stupid.
Well, that was a short taste of what the program is going to be about, but your show is going to be, let's get the facts out about where people who might be intrigued by this can go and watch a longer version.
Okay, it's going to be at the Holy Cross Church Parish Hall, which is up on the mesa, above Cliff Drive and Meigs Road, that area. The parking and entrance for that Parish Hall is off of Dolores Avenue, if you look at a map. And it's going to be from 7 to 9 o'clock on June 20th, which is a Monday. And the movie's only about 30 minutes, but we'll have lots of discussion afterwards.
Do they need to make a reservation or just show up?
No, just show up. That's fine.
And it's not. There's no charge.
There's no charge. It's
and no
absolutely
obligation.
free. No obligation. That's right.
Okay.
And even if you're an opponent, we invite you to come. We'd love to discuss it with you.
So when they get there, they're going to watch this film, and then they'll provoke some conversation, and they can either get other ideas about healthcare alternatives, or they can find people who are kindred spirits who are trying to make some more affordable form of healthcare available to people in this country.
Right, and hopefully if they are interested and they agree, that maybe they'll join our group or some other similar group and participate either financially or by volunteering.
Okay. At this point, I want to step back and take a somewhat more cynical approach to the optimism that comes from watching a program like that and knowing that there are people like you out there trying to do these good things. We followed, in fact, the last time you were on the air with me, we mentioned in brief this wonderful experiment that was being initiated in Colorado Care. The citizens of Colorado had got an initiative on the ballot that would provide complete health care, no-cost health care, single-pay health care for every resident of Colorado by simply assessing a payroll or payroll tax.
Payroll and income, it would be both
because
work
people don't have
and,
payroll. But no insurance premiums, no deductibles, no other complicated thing. Very clean, forward, and theoretically extremely much less costly form of health care for the citizens or residents of that state. Anybody who happened to be there, if I'd been driving through, I would get health care if this law became part of their choices. But, so it's going to be on the ballot, and at that point, public opinion was strongly in favor.
Yeah, it was running 60, 70% in favorable.
Okay, and then what happened?
Well,
it's not over yet. I shouldn't be too...
Right, the vote is not until November, and as has happened in all other similar initiatives, if things are polling well for the pros for single-payer reform, that those who stand to profit, and they're businesses, and they have boards of directors and they have shareholders who want them to make a profit, and something like this would cut into their profit. It would not put them out of business, which is a myth that gets thrown out. I mean, drug companies would not go out of business.
No.
Insurance companies and insurance agents do other products rather than not just health care. There are administrative things that insurance companies could be contracted with to do. Yeah. But it would certainly reduce the cost of providing health care, and those extra dollars would then be transferred to actually provide care to be sure that everybody got care. In Colorado, they're going to include dental care, which is going to be a big part of the increase or new funds that are going to be needed. But all those funds are going to come from the administrative savings and the savings in purchasing drugs and medical equipment. So it pencils out. I think they save about $2 billion the first year. So it would be a good program. But the drug companies and the insurance companies want to preserve their state and of profit making.
If this initiative was to be able to be successful, it would be a great first step. I don't think anybody else in the country, there's no other state in the country that has a program like this.
No, this would be the first one. It would be a state program. Medicare would stay the same, but the Colorado Care would provide the supplemental. So you wouldn't need...
It's just such a clean idea.
Right. One place to send the bills, the doctors send their bills to, one place that collects the money, one list of benefits, so it eliminates all of that confusion.
So if the audience is interested in learning more about this, go to Colorado Care, one word, and look it up on the internet, and you'll find that there's some information about what they're doing, and you might be compelled or feel compelled to help them out a bit. I sent some money to them just because I think what they're doing is so admirable, and I'd love to see it done. But to this, the last number I saw, they have maybe $35,000 or $40,000 in their kitty, and there's literally millions being brought to bear against them. So there'll probably be the public will probably be told a bunch of untruths and distortions which will maybe defeat this, but I want to hope until November that the Colorado Care people are successful in this great moment. But in California, we're going to have a similar, not similar, but we're going to have another initiative. Now, I told you I get discouraged because we do these things. Colorado has done it. California has tried in the past to put things in the ballot. The big money comes in and stops it. The latest iteration of this in California to try to bring affordable drug prices to at least some of the people in the state and to the taxpayers of the state is a thing called the California Drug Price Relief Act. And that's going to be on the ballot in November in California, and it was put on there. And the idea of the California Drug Price Relief Act, much less radical than Colorado's ideas, but the idea is that nobody, the state of California will not have to pay any more for formulary drugs, prescription drugs, than the Veterans Administration would pay for that same drug. So you know that the Veterans Administration buys drugs in large quantities, and they're allowed to negotiate the price.
Mm-hmm. Yeah, and that brings that price down probably 40%, something like that.
And yet the drug companies are not losing money.
They would not. No, they would not go out of business. They would make less than they do now. They make enormous profits. Their profit margins are among the top industries in the nation.
It is, and that's why they do it, and they have ways of doing that. But so if this was to pass, the citizens of California who are paying for these Medi-Cal costs would have a huge amount of savings, and in theory, the system in California would be able to have more money for other efforts.
That's right, and it saves the taxpayer money.
That's what I'm talking about.
We're not talking about everybody being covered. It's just the Medi-Cal population.
You're not trying to give low-cost medicine to everybody, but we are trying to say the taxpayers could not have to pay so much for this system that we're providing.
Yeah. I'd rather say fair-cost medicine rather than low-cost medicine.
Okay. Well, so in this case, just as in the Colorado case, a huge amount of money is now being generated. There is money that's in favor of this initiative coming from advocates for, I think, the AIDS people and whatnot who have been faced historically with paying outrageous amounts of money for drugs. But they've got a few $1 million, California being a big state. The big pharma, Colorado being a small state, Santa Barbara being a big state.
Oh, yeah, right.
So, I think the proponents had 4.3 million a few weeks ago. At this point, the opponents to this legislation have now collected and reported over $68 million that they will be spending to try to tell people in California not to do this, not to get affordable drugs, and they'll have some horrible thing.
Yeah, I haven't seen their arguments yet. I don't know.
Well, we'll see them soon enough. You know that.
Probably, we're not going to be able to invent new drugs and.
Well, the companies are the list that you expect: Johnson & Johnson, Bristol Myers, Amgen, AstraZeneca, Novartis, Eli Lilly, Otsuka Corporation, the Pharmaceutical Research and Manufacturers of America, Pharma, which is their lobbying group. I will say by November they'll have spent probably 4 or 5 times that amount of money, which means they have a huge amount of profit that they don't want to lose, they can afford.
All right, yeah.
So in the question of who is stopping affordable health care, here's a couple culprits.
Indeed. Well, and people are vulnerable on this because they have been taught for many, many years about the evils of government control of this or that. And this is to our benefit. This is
regulation. Without regulation, we are all going to be exploited and destroyed. We will have patent medicines that kill us. We would have child labor. We would have
People forget that the purpose of government is to protect the common man from being exploited by the more powerful.
By the ones with the money and the ones who want to make more money, and can just walk away from the mess they create if they fail. And I think that's one of the things the public tends to have lost sight of. The idea of a private business is that it can go out of business. It can cease to exist. They can declare bankruptcy and walk away from the mess it created, and the damage they do is uncovered. It's unrecoverable. If government doesn't just walk away from the business it creates, it has to be there, and somebody's going to have to pick up the pieces next year or the year after. So I think I think I would rather trust government in many of these situations, even though it might be done badly by some, but they will be there, and there'll be somebody to be responsible for the disaster. They won't leave a cesspool of mines in the national park and walk away from it. Right. Okay, I'm sorry, that's how my soapbox is right now. But I thought it was interesting, though. I just want to get this thing about who's doing this, because, as I say, the list of suspects is pretty obvious. And I want to point out a similarity. It was in 2005, California also had a Prop 79, another drug control, price control legislation initiative that was going to just establish discount programs for some people in the state who couldn't afford to pay as much for the drugs. That was defeated soundly. $120 million was spent by, guess who? Pharma, the lobbying group I mentioned a moment ago, GlaxoSmithKline, Pfizer, Merck & Company, Johnson & Johnson, Amgen, AstraZeneca, Eli Lilly, Wyeth Labs, Abbott Laboratories, the same people who are coming out of the walls on this latest attempt to bring some reasonable health medical costs to this country. So who's stopping affordable health? Here we are, people who can profit from it. So what?
Politicians are also in the mix here, because some politicians thrive on using the threat of government takeover, or government direction, or taking, interfering with private enterprise and so on, and that's a big barrier too.
Yeah, let me try to understand what you're saying there.
Well, for example, in the negotiations for the Affordable Care Act, there's a provision in there that prohibits Medicare from negotiating for price of drugs.
Right. That was part of the bargain.
That's right. And if that had not been in there, then Medicare would be able to probably cut the drug bills for all the seniors by quite a bit. Instead, they have this quote-unquote insurance, Part D insurance, which is complicated and doesn't bring the price down nearly as much as just having the manufacturers of the drugs have to negotiate a price, so that if Bayer can provide it cheaper than AstraZeneca, then they'll buy from Bayer, and it gives them real competition. That's what we're supposed to be about, having
That's right. I was
monopoly.
I was waiting for you to finish your thought, because I was going to jump in with that same idea. The idea of competition is supposed to be the basis of the benefits of the free enterprise model.
Right.
And yet, if we can't negotiate price, if you just have to pay them what they charge, what they want to charge, what they put on their list price, and there's no competition for that, then how can you object to socialized medicine when what you've got is worse than socialized medicine? I don't know what the word to call it, but it's more, it's something worse. It's complete sellout of the free market idea. And we know this. We had these just terrible stories in the last few months and year about these entrepreneurs, the Wall Street kind of people coming in and buying drug companies, stodgy old staid drug companies who had a drug they've been making for 20, 30 years, necessary, effective. People paid, $30 a dose or whatever it might be, and they've been doing it for years. Their cost of development had long been recovered. They were making a nice profit, but this company was making it, was seen as ripe for takeover.
No, and you don't have a choice. Not only is there not negotiation, but when you're sick, you need a doctor, you need the medication.
So this guy comes in and buys this
drug.
Life. Yeah, he buys this company, says this drug is worth more than $30 and charges $1,300. I mean, literally, it may not be exact numbers, and says pay it or do without.
I want to clarify for the audience, this, a nitpick maybe, but socialized medicine brings to mind the English system, which actually owns the hospitals and employs the doctors. And so those of us in Reform try to use a Medicare for all, where the doctors actually remain in private practice, and the hospitals, those that are public hospitals already, remain private. What becomes a social system is the administration, the setting of the reimbursements, and the benefit package.
The insurance.
And handling the insurance, collecting the money and paying it out.
Yeah, my sloppiness on my part, I lapsed. I apologize. Thank you for calling me out on that. But yeah, I mean, I think the point is that we all know these models in our experiences. Medicare is probably a good example of what you're describing. The doctors are almost all privately.
Right. Right, and the prediction, of course, was that they would all leave, they wouldn't accept it, and they would go bankrupt and so on. And of course, doctors have actually thrived on it, even though they're being paid less than they are under, with private health insurance. They're doing quite fine, and they're quite happy. 95%, I think, of the physicians participate in Medicare.
Doctors continue to be well paid in this country. It's not; they're not among the unhappy.
The specialists, particularly, in that it's kind of warped in that the specialists get perhaps more than they should, and we have more than we need, and that also skews the system. We need a lot more primary care.
To the point of the question on the screen, who's stopping affordable health care? Part of it is this idea that you're entitled to get more money if you're a specialist than if you're a general practitioner.
Well, they should be entitled to get some more money. The multiplier, I think, is the issue. How much more, and how do you figure out how many are needed? And under a lot of reforms, there are incentives given to primary care physicians to start serving inner cities and rural areas, and that would help change that balance. Most other nations have about a 50-50 split between specialists and the general practitioner.
And the other thing that I think that I've talked about with others, and maybe you and I have spoken about it, is the tendency to close down the practice of medicine, quote unquote, the practice of medicine, by restricting the roles of, say, pharmacists, nurses, other ancillary staff who are in other countries given more authority. And it's arguable that by using lower cost staffing to do a lot of the more predictable things, we would be able to lower the cost of the service there.
Yeah, that's true. But some of that, though, I think is labor. That there's pressure for certain portions of the medical community to want to be more active. Anyway, I'm not particularly versed on that particular aspect.
Okay, I know there's a certain. If you don't have a title behind your name, sometimes people think you don't know anything, or if you do have a title, they think you do know something, and you may not.
Yeah, no, I think the trend is, though, to start spreading that out more.
Well, it used to be I know in particular pharmacists were given a lot more authority in the care of the patients. You could go to a pharmacist, and they would be willing. They would make compounding pharmacies before all these drug companies existed. They would make suitable medicines for your needs. Now, there's probably errors, and we're better off with some standardization.
Oh yeah,
but I think we should be respectful of the education and talent that goes into nursing and the pharmacy and into some of these other technical parts of the job, and not expect a doctor to do it all.
Yeah, well, my experience actually has been positive with pharmacists in that if there's a medication and I have questions about it, that's the person I go to. If I don't understand the flyer or the handout that comes, excuse me, with the medicine, then they're good source of information.
That's their business.
I think that's appropriate. Yeah.
So let's go ahead and recapture a bit. Tell us again. Your group is part of a statewide coalition, sort of loosely coordinated. If a person contacted you your phone number was
682-5183, area code 805.
If they contacted you and said, I'm interested in doing something to bring affordable health care to people, what would you say to them? What would they find they could or might do?
Well, person-to-person interaction is best. If they could get a group of their neighbors together, we have a speakers bureau, and we could send someone out if we have 5 or 6 people, and we could have a meeting to answer questions. A lot of people are for the idea, but then the opposition brings up some warped view of how it's going to work, and they say, well, what about, we're going to have a bunch of people come in from Kansas to get their health care, and we'll have to pay for that, and how are you going to work that? And it's a very complex issue, and it's very easy to demagogue, so we try to stay up to date on things and be able to answer those questions.
Straw man.
And then once they if they become supporters, then they can tell their elected officials that, you know, I really want to see this. Will you support it? We have a congressional election coming up, and the candidates, we cannot, because we're a nonprofit, we can't support individual candidates. But we want to educate people to ask the right questions of the candidates to find out, well, where do you stand on this? Would you support something like this? Would you vote for something like this?
So if the candidate sees that there are enough people interested in that side of that issue, they might be more inclined.
Yeah, except, you know, there are certain exceptions to that, that some candidates will champion the single-payer issue. They're rare. Mostly it's going to be people getting together, getting enough people supporting, and then you'll find that the elected officials will suddenly be out in front of the parade.
And that's true in some areas. I mean, Social Security has been under attack for 20 years,
right.
Especially the last 20 years, from the second Bush, 15 years, trying to privatize it or otherwise disassemble it, or, okay, we'll have it for you, but not for your children, any of these various schemes they've come up with, and yet the public support for Social Security remains, and politicians are loath to talk about, just even the Republicans nowadays.
Yeah, that's correct. And it would be the same here. If you have enough people demanding it, then it will happen. But people get discouraged very quickly. They don't realize how many people are out there who support it.
That's true.
And they're demagogued all the time. And it's been 100 years of fighting for this.
Yeah, I think in that program it refers to the fact that the United States has a 80 or 100-year history of PR campaigns against any kind of health care program that would actually provide affordable care for the masses, and all the lies and all the scare stuff.
Right. Yeah. Things like quality. They predict quality will go down. Right. Well, we're number 11 in that survey of 11 countries in a lot of areas, infant mortality and things like that.
And your group also does lobbying in Sacramento, I remember.
Yes, with the larger coalitions, we get together. We lobbied for the Health for All legislation, which now provides coverage for the undocumented children. So
so that was a success.
And that
so
was
people
a success,
who were involved with your organization felt some pride in accomplishing that.
Yeah, that was.
It doesn't always losing.
No, no. But we need to do better than incremental, because doing it incrementally is never going to work. The Affordable Care Act, as good as it is incremental, and we're still going to have 10% of the population without insurance, and no end to the inflation. It's going to go up 4% this year.
Well, we're about to end this show. I appreciate you coming back. It's just as informative this time as the last time. I appreciate it. We'll talk again maybe in a few months when we see what's happening on the ballot.
Wonderful.
Thank you all for watching. Thank you here at the TVSB. Thank you, Juanita and Ali, for working as directors on this show as you have in the past. And thanks to Ali for 28 terrific years. Ali is leaving after these couple of last episodes. Really has been appreciated.